Watching your dog have a seizure is one of the scariest things that you can experience, and hearing the word epilepsy from your vet can leave you feeling lost and overwhelmed and really unsure about what the future looks like. But here's the good news. With the right action, your dog's future can be much brighter than you might think. I'm Dr. Alex. I've been a vet since 2006 and I've helped countless dogs and their families navigate epilepsy. And today I want to walk you through everything you need to know so that by the end of this video, you'll understand what epilepsy means for your dog and what you can do to give them the best possible life. And the first thing that you need to know, especially if your dog has had a fit but hasn't had a confirmed diagnosis, is that epilepsy is just one of the possible causes of seizures in dogs. It is, though, the most common cause of recurrent seizures. The next most common cause of seizures is probably poisoning, certainly what I see in my clinic, but that usually causes a single seizure or a cluster of seizures, and the dog is normally very unwell in other ways too. There are lots of other possible causes as well, and I've got a separate video that I'll link somewhere here about those, so check that out if you don't have a specific diagnosis. But when it comes to epilepsy, what's the actual cause? Well, true epilepsy is something that we call idiopathic, which simply means that we don't always know, or we can't always identify the underlying cause. It's absolutely a result of abnormal electrical activity in the brain. You can almost think of nerves kind of short-circuiting each other, and it's that leads to seizures. The diagnosis, that means, is actually, it's often a diagnosis of exclusion. So we rule out the other potential causes of seizures. Now that can be through running tests, it can be through our examination. That might simply allow us to rule out a lot of different causes. It can be through looking at that history, looking at the pattern of the seizures. And if we can rule out all those other causes, then often we're left with epilepsy as being the only, or by far and away the most likely cause. Now, this leads us on to genetic predisposition. It's absolutely true that some breeds, and even certain lines within breeds, are more prone to developing epilepsy. Now, these breeds that are at most risk include breeds like Vizslas, English Springer Spaniels, Beagles, Border Collies, and Labrador Retrievers. And because of this genetic link, it's absolutely best and recommended not to breed from dogs that have epilepsy or come from lines where epilepsy is known to occur. Now, one clue that epilepsy is the cause of a dog's seizure is age of onset. So with most dogs with epilepsy, they are going to start having seizures between about 6 months of age and 5 years of age. If your dogs start having seizures younger or older than this, then we absolutely become more suspicious of other causes. So like structural disease, poisoning, trauma, organ disease, or even cancers. And then once a dog has an epilepsy diagnosis, the next question is when to start treatment. And that is absolutely a decision that can feel daunting, but there are some clear guidelines that can help. Now, this is going to differ depending on many different factors, kind of related to both you, your family, your circumstances, what you want for them. But that being said, the International Veterinary Epilepsy Task Force, there is such a thing, gives actually quite clear guidance on when to start long-term medication. And that is that you should consider starting treatment if your dog has 2 or more seizures within a 6-month period. If they have seizures that are lasting over about 5 minutes, that's something known as status epilepticus. Or if they have seizures, a cluster of seizures, so that's 2 or more seizures within 24 hours. We should also start medication if they have severe or prolonged post-seizure signs, so we call that the post-ictal period, and that they can develop things like blindness or severe aggression, or if our seizures are getting more frequent, lasting longer, or becoming more severe over time. Those are other key indicators that we should start our seizure treatment. Now, personally, if we're having 2 seizures within 6 months, that for me may not cross that threshold. That's something you're going to want to discuss with your vet. I think if we are certainly getting more than 1 seizure a month, absolutely we should use that as a hard cutoff. But like I say, it's going to depend. And one really important point to note about this is that if we start treatment early, our control is likely to be better. And then it's natural to hope that that one single treatment or whatever it is, that by starting that epilepsy treatment, it's going to mean that your dog is never going to have another seizure. Unfortunately, the reality is that the main goal is to reduce how often the seizures are happening and how severe they are. It's not always possible to stop them completely. Although that being said as well, 30 to 40% of dogs that do start treatment will become completely seizure-free once the right treatment is dialed in. Because it's all about finding that sweet spot. If we are using very high doses to try and stop seizures altogether, that can increase the risk of serious side effects. And we also don't want an epileptic dog to be so drugged up that they have no quality of life. We want them to be able to live their normal life with a really high quality of life. And we certainly don't want treatment to cause irreversible side effects just to chase that seizure-free status if they can have a good quality of life with infrequent minor seizures. And then once you start treatment, you need to know that the epilepsy treatments, they can take time to work. That is going to vary depending on drug. Some do work absolutely straight away. Others can take a few weeks just to build up into the system, and some can actually take a few months to reach their full effects. Also, many dogs, they actually do very well on just one medication. A smaller subset will need a combination of 2, potentially even 3 or more drugs. Those really are very uncommon though. And there are also a number of supportive options like supplements or dietary changes that can and probably should be part of a complete epilepsy management plan. But these are also going to take time to have any kind of meaningful effect. And I know that this can all seem like a lot to take in, and it's completely normal to feel unsure about where to start because, you know, managing epilepsy, it can be complicated. It can be very simple, but it can be complicated. And every dog's situation is unique. And that's actually why I built an interactive tool that gives you personalized guidance. It's the next best thing to having a vet in your pocket. And this tool will walk you through step by step every stage of your dog's epilepsy journey. If you're interested, then I'll leave a link in the description where you can learn more. And so let's start talking side effects. So when starting medication, it's really actually quite common to see some side effects. Those are normally really minor, so we can think of increased thirst, a bit of increase in urination, an increase in appetite, certainly, maybe a little bit of wobbliness, a bit of sleepiness, and intestinal upset, so a bit of diarrhea, maybe vomiting, is all quite common, but they are usually mild, so don't be scared by these, and they do tend to be very short-lived, so a few days to a week. That's all it takes to resolve them as your dog's body just effectively gets used to that medication. We'll also often do blood tests to keep an eye on general health now, especially liver function here. For some drugs, we'll also check blood levels of that drug just to make sure that it's in what we call the therapeutic range, so the range which we can expect it to do the job that we want it to do. There are more serious side effects. Liver disease is one of them, especially with phenobarbital. That's one of our more common anti-epileptic drugs. Those side effects do differ from drug, but by and large, they are very uncommon. It's important to be aware of these side effects, but don't be scared by them. They generally are very uncommon to even incredibly rare. And ultimately, most of our epileptic dogs will need long-term medication to be able to live the life that you want for them with a really high quality of life where seizures don't have a big impact on their day-to-day. Now, one big consideration for epileptic dogs is what constitutes an emergency. The general rule here is that for seizures lasting more than 5 minutes, or if a dog is having several seizures that's happening very close together, potentially without even recovering properly between those seizures, those are absolutely emergencies and your dog needs to see a vet immediately. It might also be that your vet actually provides you with a treatment. The most common one here is rectal diazepam to give to your dog in the event of either of these emergency situations. The good news is that most seizures only last about 30 to 60 seconds. Now, they're going to feel a lot longer to you while you're watching your dog have a seizure. It's really one of the most unpleasant things that you can have to go through watching your dog experience. But these seizures are not emergencies that require a visit to the ER. Of course, though, if you're ever unsure, it's always best to call your vet for advice straight away. Now, one potential trigger of emergency seizures is stopping medication or missing doses. So you need to know that dogs with epilepsy, they will likely need lifelong medications. Now, in some cases, it is possible that their treatment can be reduced or it can even be stopped altogether, but this should only be done under the direction of your vet and carried out in a very slow step-by-step manner so that we aren't triggering these really severe changes. And actually, even if you're changing their diet, any changes need to be gradual because changes here can also upset seizure control. And then speaking of seizure triggers, let's actually talk about what can set off a seizure. So you know that flashing lights can trigger some human epileptics. Well, seizure triggers can also often be identified in about 3 out of 4 epileptic dogs. And these seizure triggers can vary hugely from something like hormonal changes for an entire female dog coming into heat. That's a really good reason to spay or castrate an epileptic dog, through to stress or excitement. Importantly as well, a single dog is likely to have multiple different triggers, or again, very commonly, a combination of triggered and seemingly random seizures. So don't feel that every single seizure your dog has must have a trigger. And the other consideration, though, in identifying them and challenge here is that the effects of a trigger might not be immediate. They can be delayed by as much as 24 to 48 hours before that seizure event happens. And that's why keeping a seizure diary is so important, because it can be tricky to figure out what's triggering your dog's seizures. It's really hard to remember exactly how often they are having those seizures and how long each one is lasting. So write down when and where each seizure is happening, how long it's lasting, how long recovery took, and what your dog had been doing or experiencing over the previous couple of days even. You need to go back that length of time to be able to look for triggers. Also include when seizures started or when doses were changed, because all of this information, it can really help to spot patterns and actually guide successful treatment and really allow you to nail in your dog's epilepsy management plan. And then finally, and the most important thing to remember, is that the vast majority of owners of epileptic dogs report that their dogs have an excellent quality of life and they also have a normal lifespan. So your dog can absolutely live normal, happy life between seizures as long as they're on the right treatment plan. And that plan might include medication, it might include supplements, it might include specific diets, which I break down in this video linked on screen. So tap on that video. I'll see you over there. But until the next time, I'm Dr. Alex. This is Our Pets Health, because they're family.